Compliance is that dirty word out there that you just have to kind of put up with. Well, no. Compliance is there to protect you and keep you out of trouble, and to also keep the unscrupulous out of Medicare. So let's just take a look at what is compliance. Okay. First of all, most carriers require a compliance assessment to become appointed. In other words, you have to gone through and learned all the rules and all the products before they'll even let you handle their product. Compliance are the guidelines that help steer aggressive sales tactics out of Medicare. The example I always like to use is that if here we are getting ready to open up, and it's we'll just pretend it's Friday the 15th. You could start selling plans, and if you start applying pressure like if you don't sign this today, you won't be able to get health coverage. Well, that's blatantly false, right? We're to compare that to on December 6th or December 7th, that if you made the statement that if you don't start, if you don't enroll in this now, you won't be able to start on 1 January. Now, that's a true statement. Okay, so trying to keep the aggressive sales tactics out of Medicare. That's one of the ways that they do it. And it usually comes down to just doing the right thing for your clients and not your own self-interest. That's pretty much the standard insurance mantra, right? In other words, what's suitable for the client. That is the key thing to understanding compliance. It's all about the customer. All right, well, we're getting ready to start the annual enrollment period. So let's talk about that and how compliance relates to that here at the beginning. Right now, we always say that open enrollment begins on the 15th, which is true, but being able to show the plan started on October 1st. You couldn't take a sale, you couldn't submit an application, but you could show them the plan. Okay? And here on Friday, the 15th, things will open up where we can actually sell the plan between now and December 7th for coverage that will begin on January 1. So where does it start? That's kind of a rhetorical question. It all begins with being ready to sell. That means that you've successfully completed your AHIP, all the Medicare training, all the compliance training. You've done waste, fraud, and abuse training, reporting. If you've got all your tools for compliant selling, you know what to do, and we're ready to launch. Okay. You've also met up with the carrier, right? And so you can do their PPO plans, HMO plans, PDP plans. Some carriers require special training to do the SNP plans, the special needs plans. And like United, if you want to host an event with United, you have to complete their event training. Okay, and now let's make sure that you're licensed and appointed and certified in every state in which you sell. Typically, a lot of the carriers will require that for the state you're in, okay, not the state you're selling in, but the state that you're in, you've attended some of their detailed product briefings, but it's not going to be for every state that you sell in. Okay? And then finally, you need to get that notification from the carrier. You should see an email. This is mine from Aetna. And you see it says, the 2021-2022 Aetna MA MAPD plans and the 2021-2022 SilverScript PDP plans that I can sell. okay? And it's very specific. This is mine from Humana. Notice here it's a little bit different. They kind of send me a cover letter with an attachment, exhibit saying what I'm authorized to do, and it's basically I can sell all of their plans. Okay? This one is from United Healthcare. There it's a little bit different. I have to actually go into my profile, and it'll show what states I'm allowed to sell in, and then it will show what my status is. So you can see here for 2022, the top 3 ones there. I can do their Medicare Advantage, prescription drug plans, the AARP Medicare Supplement plan. Now notice the other ones didn't break out the supplement, but United does. I can sell their chronic and dual special needs plans, and I can hold events, under the United's name. So the eligibility, and you really need to kind of review this with each customer as you do it. Okay, you got to have that signed scope of appointment. Always a lot of questions about the scope of appointment and when that needs to be done. We're going to break that down in a moment here a little bit more. So for every time that somebody wants to buy something, we have to verify that we've got that signed scope of appointment, that that person is entitled to Medicare Part A and enrolled in Part B, that you've verified their eligibility, that they live in the service area for the plan that you're selling. You need to understand, but most of our customers don't understand that Medicare is very specific. It is literally down to the zip code and county that the customer lives in. I have literally seen where one side of the street is one county, the other side of the street is another county, and what's available is different on each side of the street. I mean, it's that specific. And that this is one of those statements you need to make to the customer that just seems redundant, and there's going to be a lot of those, and I'm going to go over them with you, that you must continue to pay your Part B premium. Okay? I've actually had, I've only had one client do this, but and that's when I really started hammering away that I made sure that I told them this. Was I had one customer who thought that since they had bought the Advantage plan, they no longer needed Part B. Okay? And so they stopped paying for it and dropped their Part B coverage. Of course, the Advantage plan immediately dropped their coverage. And I get a panicked phone call from the customer. Why did they drop my coverage? And then when we dive into it, we find out that they had terminated their Part B. Okay? So they were able to, in their particular case, they got an exception that let them get back in again to Part B. As it turned out, it was a deaf person, and so that everything had been done via sign language, even though it was over the phone through a sign language interpreter. They were able to convince CMS to re-enroll them in Part B, not make them wait for the open enrollment, and give them a step to get back into their plan. But that's the rarity, not the norm. But so just be really careful and make sure that they understand that. All right, so let's talk about the SOA. Okay, you need to have one of these, and it's going to be on what coverages or products that will be discussed. Now, saying discussed is kind of loose, right? If somebody calls me up and just asks me some general questions about Medicare, and I'm not going to get a scope of appointment for that. Okay, that's just general. It falls under education, and that's not going to be required. But the moment we're going to talk about a specific product, excuse me, I need to have that scope of appointment. So I always figure the sooner the better in the process. Just know that by the time we get down to doing a sales presentation, it's required. And not only that, is if they only said they wanted to talk about an MA plan and then decided they wanted to talk about something else, a prescription drug plan, a cancer policy. I mean, I can talk about all those, but if we didn't mark that on the scope of appointment, we're going to stop and we're going to go back and we're going to do a new scope. Okay? So it's very critical that we do that prior to any product discussion, right? And it's more specifically any sales presentation. So here's an example of just a generic scope of appointment. It doesn't matter what scope of appointment I use. And I just want to make sure you understand that. I can sell a United plan after having used a Humana scope of appointment. I could have used SilverScript because all we were talking about was drugs, and then we decided that we wanted to get an MAPD instead. So all I had done was a SilverScript scope of appointment. And it really doesn't matter. The rule is that the scope of appointment must be a current CMS certified scope. Okay, that's it. Doesn't have to be from any particular carrier to sell that carrier. So I can use just a generic, and I have those that I keep for you never know. Okay, and but the reality is, I usually recommend getting very, very comfortable with one company's scope of appointment. Like I said, I have found that the one from United in the lean system can be done spur of the moment. I can do it on my cell phone, I can do it on my computer, I can do it on my iPad. I mean, it's very simple, and I can collect that signature, and I'm covered, right? So, and I also keep a pad of standalone scope of appointments, just in case, go to an appointment, somebody else shows up, and you got a new one. It's just easier to hand them a piece of paper for them to sign. Yeah. I always select all 5 blocks. Okay. I've never gotten any blowback on that. And I usually just tell them we're going to mark all of these because if we're here today to talk about, an Advantage plan, but if you hit me with any question that falls outside of that, we would have to stop, go back, do a new scope of appointment. Let's just get all that out of the way and we're free to discuss whatever. And that's always worked for me. I've never got anybody that says, oh no, I only want to do hospital indemnity plans. No, that's just never happened. Right? So one of the, like I said, the key thing, key takeaway, must have one prior to the sales presentation where you're really getting specific and talking about a particular product. We've left the realm of educational or just a discussion about Medicare and gotten very specific into a particular plan. So you just want to make sure that you have it by then. The sooner, the better, in my book. So these are the 3 biggest complaints that come out of CMS. This is year after year. I didn't know I was enrolling. My doctors aren't in my plan's network, and the prescription I take is not covered by the formulary. So I always want my customers to call me first. Many times I'm just going to forward them over to the customer service of the carrier. But I want them to call me first because I want the opportunity to hear the problem before the customer files a complaint. Now, the carrier's customer service will protect the carrier first. The insurance companies will then steer customers to file complaints with CMS. It's never the carrier's fault. It must have been that agent. So learn to cover yourself and learn to protect yourself. There's many things that we're going to want to send them right to customer service for. I'm having difficulty finding a specialist that's in network. Okay? Let them get out there and they can, sort on pretty great, much greater ability. Or you may not just want to be able to do it for the customer. But a lot of times I want the customer to call me because I want to be able to head off the disenrollment. Because if that customer disenrolls from the plan, then I'm literally forbidden by law to call them. Okay, and I don't want something simple to be, to have caused it. A simple misunderstanding. I mean, I want to keep the customer. I want to be doing what's right. I want to fix the problem if I can. And I'll give you the classic example. Is here we are in October. I put a person into a plan. Prior to the plan, I verify that the doctors are in the network. Come January, customer has this new card, goes down to see the doctor, and lo and behold, they're not in the network. Well, in January, they were, but so many of these doctors are in these groups now, and the group handles all the insurance stuff. So it's one or two people out of that 50 doctors in the group who's determining what insurance carriers they take. And so what you want to happen is for you to be able to say, oh, they're not in there. We checked them, and it said that they were in October. So let me check again to make sure that there wasn't just some mistake there. And in fact, if it was, I'm going to find out what company that doctor is taking now. And I want to be the one that enrolls them over into the Humana plan. They don't take Aetna anymore, right? I mean, whatever that is, I want to be the one that fixes the problem. It's much, because like I will tell you, when I talk doctors with my customers, I always tell them at some point in that conversation, and I'm verifying that your doctor is in the network, but that doctors and hospitals come and go from these networks on a fairly regular basis. Some have greater persistency than others, but it's not unusual. And so that if that does happen, give me a call and we'll see what we have to do to fix that problem for you. Okay? Which is another reason I tend to stay away from HMOs and concentrate on the PPO plans. But for some customers, that HMO is going to be the better plan. But so just keep that in mind. I didn't know I was enrolling. Okay, here's after you've finished up with the enrollment or the discussion of the plan, and this is the one that we've decided, you need to make a statement such as, all right, we are now going to enroll in the AARP Medicare Advantage Plan 2 HMO H3805-036-000. Do you want to enroll in this plan? That clears that up every time. Okay, I've got that, and I'll talk about this even more in a minute, that I want to record everything. Okay, I want to record it because when you complain that I didn't know I was enrolling, it's pretty simple to, when I'm answering that complaint with CMS, that I submit the recording of the conversation, and here's this statement of, this is what we're enrolling in. Do you want to enroll? And they say yes. And now they're saying, I didn't know I was enrolling. You gave me an affirmative statement that said that you did. Okay, so I will not be found at fault for the customer not knowing that they were enrolling. Yeah. If they've got Alzheimer's and I didn't know that, or early stages and dementia, or maybe they called when their dementia, they were sundowning. I mean, for all those reasons that they couldn't know that at the time. I mean, I can't protect against that, but I can have that recording that has me stating the fact and them answering the question. Okay. And I talked about the doctors, but we're also going to look at all the prescriptions. Okay. We're going to look up every one of them. And I want them to be able to call, I want them to call me when that doctor writes them a prescription for something and it turns out that's not part of the formulary. I mean, the doctor typically just turns around to his pad and writes the prescription and doesn't go and say, hey, or which formulary plan, let me look it up to see if it's covered. I've never had a doctor do that. They simply went to their pad, wrote the prescription, and sent me off to the pharmacy. Or even better yet, I called them on the phone and they said, okay, I'm going to handle that with a prescription. What pharmacy do you want to pick it up at? And I may not have ever even seen the doctor other than maybe online or the phone call. So when that happens, I want that customer to call me again and give me that first chance to, it sounds like we're going to need to do an exception. Okay, and they say, what's an exception? Well, that one's not covered by your formulary. And so what we're going to do is get permission from the company to cover it for you, even though it's not in there. And so that I can handle that problem. I just don't want it to turn into a complaint. So when we're doing that Medicare Advantage plan, here's kind of what we're going to do. And this is every time. Okay? I'm going to announce and identify the product name that's going to be at the beginning of my sales presentation. Again, remember I showed you I was going to repeat it when I did the enrollment. But it's going to be that same. I'm going to be that detailed, exactly what plan it is, including its plan number. Okay, and when it comes to the plan rating, the only rating you will ever talk about is the overall rating to the plan. This plan is rated at 4.5 stars. Now they've covered many areas, and if you go over to page 56 in the enrollment guide on your own time, you can see a breakdown of how that star rating was put together. Just know that this plan is rated 4.5 stars. Because if you say, this plan's rated 4.5 stars, but it has a 5-star rating for customer service, the only takeaway that they'll have is that they got a 5-star rated plan. And if that goes, and you had to even submit that recording to CMS, you lose, right? It doesn't matter the fact that you said it was 4.5, and then you mentioned later that in a particular breakdown area it was 5. CMS will, find you at fault for giving the impression that the plan had a higher rating than it did. Okay. Eligibility requirements. I covered that a little bit earlier, but you're literally going to go over that with the customer, including that part that says you must continue to make your Part B payment. And make sure that they understand that. Eligible for A, enrolled in B, in the plan service area, making their Part B payment. Those are all the eligibility requirements. You're going to explain the enrollment and disenrollment periods. And by that I mean, here we are in the AEP. So all the plans that somebody signs up for now is going to start on 1 January. Okay, unless they're new to Medicare. I mean, there's still people that are going to age in here in November and December, and we're going to sell them plans. And we're going to explain to them their enrollment and disenrollment also. But it kind of, goes like this. We're enrolling today in that AARP Medicare Advantage Plan 2 HMO. and that it will begin on 1 January 2022. You should see everything in the mail, a new card and all of that prior to that. Should you want to disenroll from this plan, I want you to give me a call and I will help you through the process. You can disenroll from January 1 to March 31st and return to original Medicare, or you can change to a different plan. Give me a call and I'll walk you through the process. I always say it that way because if they disenroll, they go right to the carrier and say, or CMS and disenroll, I'm literally forbidden by law to call them to find out why they did that. I just want them to call me to disenroll, and I'll take care of it for them. Because when they turned out that, they discovered that there was a plan that had better benefits, or that they talked from talking to their neighbor, or whatever, I just want to be the one that does the enrollment for them. I don't really care. I mean, I'm doing my best job to get them in what I think is the best plan for them. But if they have a change of mind, I want to be the one that helps with it and continues to draw that commission. We're going to explain the plan premiums, coinsurance, and copays. And by that, we're going to take that out of the enrollment guide. We're going to take that summary of benefits, and we are literally going to go every step by step through there with them. And this is going to be our opportunity to do a lot of things. Okay? So not only do I go over that, here's the premium, here's your coinsurance. If you're hospitalized, you're going to be paying $450 a day for days 1 through 3. And at that point, I always say, and would you want to make that payment, or would you like to learn how somebody else can make that payment for you? Who doesn't say yes to that? I want to know how somebody else can make. Doesn't mean they're going to buy the indemnity plan, but if I don't give them the option, they'll never buy the plan. I just want to be able to show them. And my experience is I can typically cover the big stuff on their indemnity plan for under $50 a month. Okay, that's the per day hospital, because the next big item I'm going to talk to on there is that skilled nursing facility, and it goes to $185 a day following on day 21. And I'm just going to show them how to protect themselves from all that. Don't want to leave money on the table, but I want to be very compliant with my Medicare Advantage plan. So I just want to go over all of those copays with them and make sure that they understand. And if there's other benefits in there, I'm going to cover that. Many times you'll see the optional supplemental benefits that'll have a cost. You must mention them. You have to tell them about that. Doesn't mean they have to take it. In fact, usually when it comes to dental, the classic for me is that the plan will do preventative only. And I tell them, in January, I want you to go to the dentist. Okay? And it's going to be covered. It'll be no cost. I see this provides, preventive dental. They'll do your checkup, they'll do the x-rays, they'll do a clean. And if you need work, we'll find out at that time. And if you do, call me back, and we'll either add dental to this plan, or depending on what you need, we may just do a separate dental plan. Just lay the groundwork, get it all ready to go. Remember, you marked it back there on the SOA, so you're covered to discuss that. But I always just like to lay all that groundwork in there, make sure they understand to call me when they want those things. Okay. We're going to go over the provider network. We're going to see what doctors they have. We're going to look up that doctor. We're going to verify that doctor is in the network. There's a lot of services out there that will look up doctors for you. You could be using, say, JSA, and in their system that When you're looking at what's available, you can put in doctors and they'll look them up for you. Sunfire is another one that will do that. But your best and safest is always to go to the company carrier's website and look up the doctor. Okay? Verify at least at the time of enrollment that doctor was in the network. Verify that. Okay, go over that if there's any limitations. Referrals. Does the plan require that you get referrals? If it's an HMO, odds are it requires a referral to see a specialist. Some don't. You see those point of service plans, POS. Some of those don't require referrals. And generally, if it's a PPO, it does not require referrals. And I tell them that at the time. Go over that in and out of network. All the plans, regardless, have a network. And it will always, and even if it's a PPO that lets you go out of network, the cost will always be less in network. Okay? Most of those plans, if you have that PPO and you want to go out of network, there's a $10,000 max out of pocket. So you could, if they don't understand that, it could have easily been, $4,000 in network and $10,000 out of network. So let's make sure the customer at least knows that before they let them make the conscious choice to go out of network. So we'll go over that cost sharing, emergency coverage. We're going to explain to them how it works and make sure they understand that that emergency coverage is nationwide. Some cases it's worldwide. But here's the thing about worldwide coverage. Medicare itself is not accepted by any doctor outside the U.S. Medicare will not pay those doctors. You can have a plan, though, that will have, provisions for being outside of the U.S. Here in the U.S., we're very accustomed to going to a doctor, hospital, pharmacy, showing them our card, and they do all that behind the scenes stuff, right? They, I do it with just a copay. They don't bill Medicare. They don't bill the insurance provider that I have or any of that. Outside the U.S., they don't do it that way. Most of those countries, like if you travel over to Europe, those countries have national health plans. They're not out there billing the U.S. for that stuff. So just understand you're going to be making the payment and filing a claim when you get back and being reimbursed. That is their out-of-country coverage, is them paying you back for what you paid while you were outside of the country. Okay, just make sure that the customer understands that. Because when you tell them that it's got worldwide service, they think that they can just simply go into the doctor and show them their card. No, it does not work that way. Okay? Make sure that if they have that Advantage plan, that they understand that it's different from a Medicare supplement plan or a Medigap plan, right? Just cover your own butt. You don't want the complaint that he told me or she told me, right? So you want to be sure that you do that. Now we're looking at Part D. Even though many people get their Part D as part of an MA plan, it's not a standalone plan. It is actually a separate plan paired with their MA plan. It is not one plan that includes drugs, because you notice in there that there's a separate Part D deductible, that the Part D drugs are not subject to the max out-of-pocket of the plan. In some areas, you'll look at what's available, and you'll see that a carrier's got 4 different HMO plans at different prices. Usually, that is the different formularies being attached to the plan. Yeah, that $70 HMO probably had a far more robust formulary than the $0 plan did. Okay, so what we're going to go over with them is the deductible. And we all know that, at least you should, that for 2022, the maximum deductible for Part D is $470. That does not mean that that's the deductible on the plan. You have to read it off there. And the deductibles can be a little bit more complicated. I mean, it can be that it's zero deductible for tiers 1 and 2, and it's a $150 deductible for tiers 2, 3, and 4. It's going to vary by plan, but you're going to read off, going back to that summary of benefits, if it's to see exactly how the deductible is applied to that plan. I mean, there's plans with no deductible at all, and then there's plans that enforce the full deductible. You just need to know which one you got, and then what have they done in there to change that. We're going to look at the different tiers of coverage. Now, if you can dive into Medicare itself, they really only talked about 3 tiers. Okay? When they talk about that model plan that all are measured against, and they use tier 1 generic, tier 2 name brand, tier 4 or tier 3 is specialty. I mean, those are called out by Medicare. The typical plan is going to be 5 or 6 tiers. And they're going to use the tiers of tier 1 preferred generic, tier 2 generic, tier 3 name brand drugs, tier 4 non-preferred drugs, which could be either name brand or generic, and tier 5 is specialty drugs. And then at tier 6, if they have one, takes us to that coverage gap. Okay? Some drugs will have their maintenance, the maintenance drugs, which can be, maybe the cholesterol pill or the blood pressure pill. Or, I mean, you've all heard the names out there. There's just a lot of them. The thyroid, levothyroxine, or insulin. Okay? These are kind of maintenance drugs, and they will have a tier 6 that they're part of that continues the copay through the coverage gap. Okay, so instead of paying 1/4 of the cost of the drug, you continue with your copay until you reach the catastrophic coverage. And catastrophic is then going to be the 5%, but the tier 6 was trying to protect people through the donut hole. Now, plan formularies. You need to know how prescription drugs are covered. So we're going to look them up in that plan's formulary so that I can tell the customer that the drugs that they're taking, 1, that they're covered, 2, what tier they're in, and 3, an estimate of what their annual cost is going to be in that plan. Okay? We're going to talk about the pharmacies. Ask them which one they use. See if it's a standard pharmacy or a preferred pharmacy. A lot of people will stop there. I like to take that a step further, that if the one that they tell me they use is a preferred pharmacy, not a preferred pharmacy, but just a standard pharmacy, I would find out what the preferred pharmacy in the area, and then let them know what the savings would be if they use that one instead. Okay? It can help. A few items that are very specific to Part D coverage that you need to make sure that when you look up the drugs, that you'll see whether or not that they were included in there. You'll see where it'll list the drug along with the tier. It'll also say things like PA for prior authorization, ST for step therapy, or QA for quantity limits. And what those are telling you is that for the doctor to prescribe that particular prescription, a prior authorization from the carrier is needed. Okay, so that they can't just write the prescription and send you off with it. They need to get a prior authorization. That step therapy, that's usually seen when they try to prescribe a very expensive name brand drug that has a generic with it, equivalent. And so that step therapy is going to force the customer and the doctor to try the lower cost drug first. And if it works, great. If it doesn't, then they can go with the more expensive drug. Quantity limits is just a limit on how many of them you can get at any one time when you fill it. Okay. And then the exceptions. So this is what takes us back to why I always want the customer to call me. And they come back and they go, my doctor wrote me this prescription and it's not in the formulary. They want $400 at the pharmacy. All right, well, let's see if we can get an exception for you and get that covered. Okay. So now that they're thinking that it costs them $400 and you get an exception. Exceptions are typically brought in at the tier 4 level, which has a $100 copay. So that when they went $400 down to $100, I mean, they may not like the 100, but the shock is over, right? The shock was the 400. You did them a favor. You got that down. You saved them $300 on that. So I want them to always call me when that happens. Now the transition, let me tell you where that comes into play. Normally you will see that when somebody has moved and they've come to you for a new plan. They know they've moved from one state to another. Whatever they had in the prior state is not part of their is not available in their new location, so they have to get a new one. And as you do the research, you find that nobody in that area with that drug has it in the formulary. Well, under the transition rules, they have to provide within that first 90 days of the plan a 30-day prescription for that same drug. And the purpose behind that is now that you found out that they can't get it covered, it gives them 30 days to get with the doctor and find something that they can substitute. Okay, what can they change over to? What else is in that therapeutic category that they can use? Remember that the rules for formulary is 2 drugs in every therapeutic category must be there. Now, maybe that was the 4th or 5th drug in that therapeutic category, and they have to switch to one of the 2 because this one only covers 2 of them. I mean, whatever. Okay. So those are the things that'll keep you out of trouble in the prescription world. Now let's talk about what they call the secret shopper program. And employees of the Centers for Medicare and Medicaid Services, and they can be part of the carrier. Okay, the carriers do this also. And what they do is they simply, they'll call you up and they'll want to know some information. Okay, they're looking for things like, did you make me do a schedule, an SOA, right? For one, because that's something that's required, right? I'm supposed to do an SOA. Did they do that? Because they're going to call in and they're going to ask some very specific questions. So that means that you got down into the presentation level, so that you're going to have to be able to have had an SOA to do that. Usually they're very easy to spot. They come up with things like, oh, I got your card from a guy on an airplane. Well, I know that when I first started off in this, I didn't have a card. So don't tell me that you got my card from somebody. I mean, it's just that flag that goes up, right? I mean, I have cards now, and I could get that, but always just try to, let you know how they start. And they're always shopping for someone else. They're rarely shopping for themselves. And that they're going to ask, do you handle the XYZ plan? And of course, they already know that you do, typically. And so they'll ask you usually a pretty specific question. And they'll want you to, so you have to do the SOA because you're getting into that presentation portion. And then to answer those questions, it'll usually be a prescription, and they're looking for you to tell them that it requires prior authorization or step therapy or has quantity limits attached to it. I mean, they're just going to be looking that you're telling them that, and then they're just going to say, "Oh no, I'm just kind of shopping," and then kind of move on, right? So you just need to know that those are the kind of things. Just follow all the rules, and you'll be good. Okay, so that's the way it works. They'll never tell you that it was a secret shop unless you fail it. All right, so like I said, if we just follow the sales process, that will save you. Just behave ethically and follow the process. Okay, like I said, integrity and desire to do the right thing will carry you through most secret shops. I always say this one is understand why the rules are there and use them to your advantage. Okay, we'll stop here for a moment and talk about this because I always record my enrollments and discussions with people. So I like to do the enrollment and meeting on Zoom. Record's very easy. Just keep it on the hard drive. I guess I can put it over onto a thumb drive if I wanted to meet the 10-year requirement. But so I've got everything kind of stored up. Okay? In there, I always tell them all those little rules and stuff, right? In other words, I looked up your doctor. The doctors come and go. If I look up your prescriptions, they're all covered. These are the things. I just go over all of that, and I make sure that I've covered everything. Because when that customer complains, because they didn't call you directly, they went right to customer service. Customer service, again, is protecting the carrier. What, your agent didn't tell you about that? You need to file a complaint with the CMS. Let me get you through the process. So they've shifted it away from them and off to CMS and you, right? So it is so easy to answer that complaint with they email you, they give you a form to fill out. It's all online, and they want you to submit back to them, any notes that you have and any recordings that you made. So it's real easy to say in your response that's please see attached recording at minute 8. That item is discussed. Okay, so when they say the agent never told me that, it's real nice for them to be able to play the discussion, you discussing that item with the customer. And I could give you a much more specific example. Is I had a customer that specifically called me looking for an MA plan that covered transportation. Okay, so just keep in mind that's the beginning of the conversation. Is I want a plan that has transportation. I see that advertised on TV, and JJ Walker says that they got it. I want that. Okay. Well, as we go through and we qualify the customer and all of that, I sort, through all the plans based on who has transportation. I find, a plan that does, and in this guy's particular area, there was only one or two, and we looked them up. As it turned out, his doctor didn't take either of them. So we then starts the discussion. What's more important? Is it to have the transportation and we'll change doctors, or is it more important to keep the doctor that you have? So that's the whole conversation I have with the customer. And the customer says, I really don't want to change doctors. So I wanted a plan with, that had transportation. And I'm back telling them, well, this plan doesn't have transportation, but it does have your doctor in it, and it has, all the other benefits. Okay, so he enrolls in that plan, and lo and behold, 2 or 3 months later, I get a complaint. It says, you told the customer that this plan had transportation and it doesn't. Okay, real nice to be able to, again, respond. Yes, that was what the customer was looking for. However, we couldn't find a plan that had transportation in it. And then at 24 on the attached file, you'll see that we discussed transportation and the fact that this plan did not have it. And at that point, I'm off the hook and I'm safe. Scope of appointment. Now, I always try to get that scope of appointment as early as possible, in the meeting, prior to the meeting. And the rule specifically is I have to have that prior to the sales presentation. Okay? I can talk all kinds of generalities. I can talk about, what an MA plan does versus a prescription drug plan by itself, and a Medicare supplement, and having a cancer policy and how it would pay you a lump sum of money if you were diagnosed. I've talked nothing specific, right? I haven't talked about what a premium is. I haven't talked about exceptions to the plan. I haven't talked about how the plan works. I've just talked in great generalities. But the moment we want to really nail things down and be specific about a plan and what its premium is and what its costs are, I need a scope of appointment. Okay, so can I answer questions for people without a scope of appointment? I'd say yes, as long as we stay general and not specific. In other words, I'm turning 65 and I know I need to get into Medicare and I need some plans. Oh yes, let me tell you all about that. You're going to go to Social Security, you're going to sign up there, you're going to get your A and B. Once you get your A and B, we'll look at the 2 different types of plans that are available. I'll put together some information for you on each of the types of plans and what the costs and stuff would be and what would be best for you. I need you to give me some information so that I can sort through all the ones that are out there and see what would work best for you. Okay? So what are your doctors? How often do you see them? What prescriptions do you take? What are the dosages? And let me put this together into something for you. I'm going to send you a document called the scope of appointment. I just need you to sign that. It's just one of the legal things that's required by Medicare. So I get that. So I've sent that off to them at that point. And now when we meet, I'm going to be very specific. I'm going to make a recommendation. I'm going to show them, the 2 different plans. I usually just start off with, always start with Medicare supplement. And in general, it's going to cost you about $200. In specific, if we get this plan G and we pair it up with this prescription drug plan, which, by the way, covers all your drugs, this is what the cost would be. Okay, I mean, I need one I can just say, and the other one I need a scope of appointment because I'm being specific premium on a specific plan. Okay? I hope that clears up everything for you. And if you don't know, ask. Okay, I'm always available. You can reach me at ahcpsales.com. I'm training at ahcpsales.com, and we'll be glad to get back with you. And if anybody would like a copy of this, just email me. Okay, again at training at ahcpsales.com. That's all I've got for you here today. We have great day.